Reports out of Colombia and Brazil indicate the Zika virus could spread more easily and be more dangerous than first thought. Researchers in Brazil say they found traces of the Zika virus in samples of saliva and urine, and that's raising new concerns about possible transmission through human contact. And Colombian authorities are now trying to determine if at least 3 deaths are linked to Zika. CCTV's Roy Rottenberg is following all this for us and has the latest. Hi, Roy.
Hi, Asier. The Brazilian scientists say that traces of Zika were identified in samples from 2 patients infected by the virus, but they caution that additional studies are needed to determine if the virus could be transmitted through such fluids. The team says they carried out genome sequencing to confirm those traces, but again, they're stressing it's still way too early to jump to any conclusions about transmission. Now, this is the first time the virus, which is most often transmitted through mosquito bites, has been confirmed in such fluids, and that, some say, may be a game changer. Meanwhile, in Colombia, health officials say that 3 people have died after contracting Zika. The National Health Institute there says all 3 either had or developed a rare and debilitating nerve disorder called Guillain-Barré. They're now investigating those and 6 other deaths for a possible Zika link. Many are wondering if the virus is perhaps more dangerous than previously suspected. It's already specifically risky for pregnant women, such as it's believed to be linked to a high number of newly reported cases of microcephaly, which causes incomplete brain development among children. As part of the effort to fight it, the UN is urging Latin American countries, where we've seen a large number of reported infections, to guarantee women access to contraception and, if needed, abortions.
The advice of some governments to women to delay their pregnancies ignores the reality that many women and girls simply cannot exercise control over whether or when or under what circumstances they become pregnant, especially in an environment where sexual violence is so common.
Now, here in the U.S. on Friday, the Center for Disease Control issued its own detailed recommendations for preventing transmission through sexual contact, included in the guidelines, advising men who have recently traveled to Zika-affected areas to abstain from sex with their pregnant partners for the duration of the pregnancy. Asier?
Boy, Roy, it seems every day new cases, new concerns, and a number of countries are still really trying to figure out how best to respond.
Indeed, and of course China is among them. There hasn't been a Zika virus infection in China, but the breed of the mosquitoes that spreads the virus is the dominant breed in South China. Officials have been distributing Zika screening tools at important ports of entry to China, and they say they'll carry out a mass mosquito extermination campaign in April or May as the temperatures there start heating up and the mosquitoes become more active. Asier?
Roy Rottenberg, thank you. And we have a map tracking all the countries reporting Zika cases. You can see the confirmed infections in the latest outbreaks clustered in Latin America and the Caribbean. Click on our interactive map at cctv-america.com.